Hello there. If you're in your 50s, 60s, or even older, and you've started noticing changes in your sexual health, intimacy, or urination patterns, I want you to know that you're not alone. Many men your age are going through the same thing, although most are hesitant to talk about it. What few people will tell you is this: your prostate plays a major role in all of these changes. As a doctor who has spent years working with middle-aged and older men, I always encourage my patients not to shy away from facing these issues. And more importantly, to have open conversations about their sexual health. Because this isn't just about physical well-being, it's about confidence, happiness, and long-term quality of life. What role does the prostate play in your sex life? The prostate is a small gland located just below the bladder surrounding the urethra, the tube that carries urine out of the body. But it is much more than just a valve. The prostate produces most of the seminal fluid that nourishes and protects sperm, helps propel semen during ejaculation, plays a role in coordinating the pelvic muscles, which are closely connected to erectile function and urinary control. When your prostate is healthy, you barely notice it. But when there is a problem such as benign prostatic hyperplasia or prostatitis, everything changes. What starts to happen after age 50? After the age of 50, testosterone levels begin to gradually decline. At the same time, the prostate tends to enlarge, a condition known as benign prostatic hyperplasia. As a result, many men may experience frequent urination, especially at night, weak or intermittent urine stream, difficulty controlling the flow of urine, weaker ejaculation and reduced pleasure, sometimes pain during or after ejaculation, a growing sense of insecurity or stress, which often leads to decreased sexual desire. Why does BPH affect sexual performance? There are several reasons why BPH impacts sexual function. Mechanical obstruction. The prostate surrounds the urethra. As it enlarges, it puts pressure on the urinary tract, affecting both urination and ejaculation. Nerve and circulation issues. The pelvic floor is rich in nerves responsible for sexual sensation. When compressed, it can lead to numbness or reduced sensitivity. Side effects of treatment. Some BPH medications may reduce libido or cause erectile dysfunction. Psychological impact: difficulty urinating or performing sexually. Can lead to feelings of failure, anxiety, and a loss of confidence, all of which further affect intimacy. Prostatitis and its impact on sexual health. In addition to BPH, chronic prostatitis is another condition that is often overlooked but very common. Typical symptoms include a dull ache in the perineum, groin, or lower back, pain during ejaculation and burning sensation while urinating, persistent discomfort in the lower abdomen. When these symptoms linger over time, they can cause men to avoid sexual activity altogether, reducing pleasure and leading to chronic fatigue or depression. I remember a patient named Mr. James, 58 years old, who came into my clinic with an exhausted expression and a clearly troubled mind. He told me, "Doctor, I don't feel like a man anymore. I have been avoiding my wife. I am afraid of intimacy because every time we make love, I experience days of lingering pain and soreness." After examination and testing, we diagnosed him with chronic prostatitis, an inflammatory condition that greatly affects sensitivity during intercourse. But what truly worried him was not just the pain. It was the emotional distance growing between him and his wife. "I feel like I am failing her. I feel ashamed. I am afraid she is disappointed in me, but I don't know how to talk about it." After several weeks of treatment and lifestyle changes, gentle exercise, and some light psychological support, Mr. James returned for his follow-up visit 3 months later. He looked brighter and more relaxed. "Now I feel much better, doctor. But more importantly, I was finally able to talk to my wife about it. Things got better, not just because of the medication, but because I am no longer going through this alone." His story is a powerful reminder. Prostatitis is not just a physical condition. It affects a man's emotional health, his marriage, and even his sense of manhood. If you are experiencing similar symptoms, do not hide it. Do not wait until things become serious. Talk to a doctor, because there are many modern and compassionate treatment options that can help restore both your physical health and emotional well-being. "I feel like I am no longer fulfilling my role. I have lost confidence. I am afraid my wife is disappointed in me, but I just cannot bring myself to talk about it." After a period of treatment, along with lifestyle adjustments, regular exercise, and gentle psychological support, Mr. James gradually recovered. When he returned for a follow-up visit 3 months later, his face looked brighter, and he shared, "Now I feel much more at ease. And most importantly, I have been able to open up to my wife. Things improved not just because of the medication, but because I am no longer going through this journey alone." Mr. James' story is a clear reminder that chronic prostatitis is not only a physical condition, It is deeply emotional. It affects relationships, marriage, and a man's sense of self-worth. If you are experiencing similar symptoms, do not hide them. Do not wait until things get worse. Talk to a doctor because there are many modern, compassionate treatment options available to help you recover physically and emotionally. How to protect both your sexual health and prostate. Smart nutrition. Ripe tomatoes, watermelon, and pomegranate rich in lycopene, an antioxidant that supports prostate health. Nuts like pumpkin seeds and walnuts high in zinc, and phytosterols beneficial for male hormones. Salmon and olive oil rich in omega-3, which helps reduce inflammation. Gentle, regular physical activity. Brisk walking, swimming, or yoga improve blood circulation in the pelvic area. Kegel exercises enhance bladder control and boost sexual sensation. Maintain a positive mindset. Get enough sleep, meditate, and make time for things you enjoy. Limit obsessive thinking about how to make money online. Avoid the constant stress of trying to make money fast for the family. Do not pressure yourself with quick, rich schemes. Chronic financial stress is one of the silent causes of sexual dysfunction. Practice balanced, emotionally connected intimacy. A healthy sex life is not about frequency, but about emotional timing and connection. When both you and your partner feel relaxed and emotionally close, your body responds naturally. Do not force yourself to perform. Like in your younger days, sexual maturity means listening to your body and understanding that intimacy includes emotional connection, not just physical acts. Explore other forms of closeness, holding hands, hugging, massage, walking together, all of which foster intimacy without pressure. Sometimes just having an honest conversation with your partner can help relieve the emotional stress that impacts your libido. You can also explore other ways to express affection, such as hugging, holding hands, massage, or simply taking a walk together, all of which help maintain emotional closeness without the pressure of sex. Sometimes just one heartfelt conversation with your partner can release much of the emotional stress that quietly affects your sexual function. Schedule regular health checkups. If you notice frequent nighttime urination, a weak stream, or unusual ejaculation, it is time to see your doctor. They may recommend a PSA test, prostate ultrasound, or further evaluations if needed. Routine checkups not only help detect prostate issues early, but also provide a full picture of your overall health, including hormones, cardiovascular function, blood sugar, and cholesterol, all of which silently affect your sexual well-being. Many men avoid medical visits for fear of discovering bad news. But the truth is, early detection means more effective treatment and better quality of life. If you are uncomfortable going alone, invite your partner along. Turn your checkup into a moment of mutual care and connection. Remember, there is nothing more masculine than a man who takes care of and understands his own body. When should you see a doctor? Frequent urination, especially at night. Feeling like your bladder does not empty completely or having a weak urine stream. Pain or lack of pleasure during intercourse. Persistent loss of libido or erectile dysfunction. Blood in your semen or urine. Final thoughts. True strength lies in being proactive. Aging is something no one can avoid, but taking control of your health is always within reach. A healthy prostate can lead to a more fulfilling sex life, greater self-confidence, and a significantly improved quality of life. Do not be afraid to speak with your doctor. Do not be ashamed to ask questions, because sexual health, just like any other aspect of your body, deserves thoughtful care and attention.